everyone, and welcome to another edition of the Seamless Connection podcast. I am thrilled today to have with me two of my favorite hospital leaders, RD Williams and Dakota Redd from Hendry Regional Medical Center in Clewiston, in Florida. I am going to let them introduce themselves because they both have very interesting and varied backgrounds, but we're here today to talk about happiness. But first, RD.
Yeah, I'm RD Williams. I'm the Chief Executive Officer here at Hendry Regional Medical Center. We're a 25-bed critical access hospital in rural South Central Florida. I've been doing this a long time, probably longer than Mina's been alive, but started out in 1981, just a long time ago, and have worked around the country and have ended up here in Florida for the past 10 years.
And I'm Dakota Redd, Chief Nursing Officer at the hospital here at Hendry Regional Medical Center in Clewiston. I've been in healthcare for almost 40 years as well. My clinical background is critical care, got into emergency care some years back, was in the C-suite for a long time, and I haven't looked back since, and it's been probably without a doubt the best part of my career.
That's fantastic. Well, I'm so glad to hear that. For both of you, before we jump into the local community and the impacts you've been making with some of the new initiatives you started over the last few years and your learnings from that, could you tell us what brought you both into healthcare? You both, as you mentioned, you've had a long career in healthcare, and as we all know, sometimes the passion dies, right? And you're just doing it as a job. But from both of you, as well as I know you guys, you actually care, and you're still, it seems, I don't know where you were at the beginning of your career, but you are still excited to talk about and deal with healthcare today as you were the first day that I met you. And I'd love to understand kind of what's brought you to healthcare, what drives that passion, what's kept you so passionate about it, whether it was a personal story that's kind of motivates you internally or just something from the day-to-day that kind of drives that fire and that passion.
Well, Mina, my journey in healthcare goes back to, it's been dinner table conversation in my home since I can remember dinner table conversations. My father was a hospital administrator. My mother was a nursing educator. And they modeled for me not only service, but being a servant leader, and how healthcare is about helping others. And so that's been my entire career, is from where I started out as a department manager, being a materials manager, serving others, making sure they had the tools and supplies they needed to work with, until my movement into the top executive position in organizations. That's been my focus, and what I want to try to do is to make sure that the folks that we work with that are providing the direct patient care to patients have what they need to provide that care, and then that our organizations can impact the communities that support them. That we want to make our communities a better place to live, so that the folks that we live with in these communities can be happy and healthy and have the best lives that they can.
And I can tell you my journey into healthcare was somewhat serendipitous in that it was a tough market for work, and my mom had worked in and out of hospitals, and she said, "Hey, why don't you try getting into healthcare?" And so I did. Now, really, I was a strong right-brained kind of person. I was very artsy, like painting and things like that. And for some reason, when I started getting involved in direct patient care, that right side of my brain was just on fire. I just felt like I was doing so much good, and there was so much more good to do. And so, that's where I started thinking of myself in terms of being an advocate for healthcare and taking care of folks. And that really was the underpinnings of my passion for doing what I do. And it's been that way ever since.
Oh, that's fantastic. And we're talking about, you know, giving back to the community. Can you tell us a little bit about the community of Clewiston? Because I know from a critical access hospital perspective, you are so tightly integrated with your community and serving the needs of your community, and you know, like the rhythms and the beats and all of that. So just so the audience can understand, because we're going to talk about how you guys were able to build in a happiness advantage for your staff. So just to get a sense of understanding, you know, what is the community your staff comes from, who are the patients you're trying to serve, and what, you know, what are their needs compared to maybe, you know, someone in the audience that they're familiar or not familiar with, just to set a little bit of context.
Sure. So, Clewiston, where our hospital is located, is in Hendry County, Florida. Hendry County, Florida, if you look at a map of Florida, there's a big hole down towards the bottom center, which is Lake Okeechobee. And Hendry County and Clewiston are on the southern shores of Lake Okeechobee. We're almost identically equidistant from the Atlantic and Pacific coast, or Gulf of Mexico coast, between the towns of Palm Beach and Fort Myers. So we're 65 miles either way. Um, we're 110 miles north of Miami. I like to tell folks that we're 90 miles from 9 million people. The county of Hendry has about 34,000 permanent residents. We see an influx during our season, the winter months for most people, from folks from Canada and the upper Midwest. They'll come and camp in the RV campgrounds and fish on the lake and do those types of things. But traditionally, Hendry County is a agriculturally centered county. Two population centers, Clewiston, which is on the eastern side of the county, and LaBelle, which is on the western side of the county. Clewiston's got about 7,600 residents. LaBelle's got about 6,000. Um, Hendry County as a whole is 52% of the population are native Spanish speakers. And then you have a whole collection of other folks that might be there might be African American or of Caribbean island descent or Central America or South America. And being an agricultural community where the main crops are sugarcane, row vegetables, citrus, and cow-calf operations, I don't think our demographics are much different than any other or any other community like that. Hendry County has a lot of things that rank it very high in the state. Traditionally, have the highest unemployment, the lowest household income, the highest percentage of the population enrolled in Medicaid, and the lowest educational attainment of any of the 67 counties in the state of Florida. So we have some challenges, but a lot of good people live here. They have trouble accessing care, and we try to provide the best care that we can to the communities that we serve.
I think the other thing I'll just tag on to that, the uniqueness about critical access hospitals. When I first got into healthcare, every community had its own hospital. And then, in the late 70s, early 80s, they started kind of buying up hospitals. And that community hospital flavor was lost in urban areas. That still exists for us here. We serve this. If you go out there and ask that community, they'll tell you this is their hospital. Their opinion may vary of it, but this is their hospital. And so that's the uniqueness that we retain from the days when I first started getting in healthcare. We do treat our neighbors. The people that we treat, we see at the local stores. And there is a very personal connection to that is very unique and certainly quite different than what you'll find in urban hospitals and those settings.
Yeah, no, that makes sense. And coming through the pandemic, how much did it change in terms of what you guys were seeing? I know a lot from both in the ED and, if there were patients that were admitted and kept for a couple of days before they were treated and released or transferred. how much did how much did the pandemic change what you were dealing with on a day-to-day basis? And in turn, how did that impact your staff?
So a couple things. First of all, there was the lack of understanding of what we were facing. And since I wasn't here during that time, I'll actually let Mr. Williams speak to that. The pandemic for us came home to us in the summer of 2021, and that was with the Delta variant. At that point in time, we had pretty much um, we were able to kind of manage pretty effectively with what was going on. There was the politics side of the pandemic and the healthcare side of the pandemic, which um, uh, probably made it much more difficult than it had to be. But in the summer of 2021, in August, our emergency department became a intensive care unit. We actually had at the high point 7 ventilator patients dependent on ventilators in the emergency department. What it required of us was to say heroic steps to care for those patients is not an overstatement by any measure. Our medical staff had to get involved. It was a microcosm of what they experienced in large urban areas. We had no place to send them because the urban areas were full. We literally had to care for these very critical patients, and so that was the big thing. Now, from a managing the pandemic angle, we were losing nurses like crazy during that time because the healthcare market had changed to where our nurses could take local travel assignments, get paid twice as much as we could even come close to paying them. And so we struggled with losing staff, the pandemic, and then which we'll be talking about soon, the culture that existed here when we were going through this. And so you'll hear us talk about, in spite of all those things, we knew we had to make changes.
Our hospital does not typically have critical care beds. I mean, we have strong relationships with tertiary and secondary hospitals on either coast, and we manage the transportation of those patients. But hospitals on either coast, from the tip of Florida all the way up to the Georgia state line, had 0 critical care beds available to accept transfers. 0 ECMO beds. There were just the system in Florida was overwhelmed. We managed through it, but we became very adept at taking care of some very high complexity, high acuity patients, much more so than you would traditionally see in a critical access hospital. But we did well. We stood up for our community and continue to.
And what was the impacts, as Dakota was alluding to, that had on culture? Obviously, seeing your fellow colleagues leave, right, with the travelers' jobs, seeing potentially some of them pass away with the pandemic, or seeing patients that you typically don't see those levels of death rates or complications, seeing that. Obviously, it was a very difficult time on a number of different fronts. How did that impact your culture? And I know you made some significant changes to improve it, which have had some amazing impacts. If you want to start talking about
Well,
that.
I mean, I think that as stress levels go, the the level of incivility increases. People they're tired. They get frustrated. They want to do more for the patients, and they can't, so they start lashing out at each other. And here are all these other opportunities. I can sleep in my bed every night, travel an hour, and make 2+ times what I'm making in my hometown hospital. So I think I'll do that and have a lot more cover in a big hospital. If they've got 5,000 nurses, we've got 90. So there's a lot more cover when you go into situations like that. So we identified that we're going to have to make a change, that we had to do something to turn around and be able to retain our staff, and despite the pandemic, create an atmosphere where people wanted to work here, to where we could bring back the folks that had left and become an employer of choice. Even if our compensation wasn't the highest in the market, it's not going to be the highest in the market. It's tough to compete with billion-dollar medical centers. I mean, we just, it's real tough to compete with. But we can address many of the other things that pay is number 8 on the list when you start talking about what attracts people and retains people in a job. So we wanted to focus on the things that were higher up the list and try to differentiate ourselves from other employers and opportunities.
Yeah, and can you talk about the happiness advantage?
Yeah. So in the middle of all this mayhem, as it were, because I met with the nursing leadership, I had accepted the full-time chief nursing officer position in June. I had some history with the hospital, so I knew where their struggles were, and the stress around the pandemic, the culture that existed, the change of leadership, all that kind of made this cauldron of really bad stuff. And so I had read the book, The Happiness Advantage by Sean Acor, quite some time ago. And I always felt like it spoke to a part of healthcare that we always struggled with. It's very interesting. I was doing a class on conflict resolution with our new preceptor group. And I said, you go through school and you get all this technical training. You go out into the medical field and you get all this technical training. But we don't make boxes. We take care of people, and we do nothing to train these leaders and these nurses on behavioral skills and how to deal with conflict. Conflict is necessary. It can be healthy. And so my hope in knowing what the background of Sean's work was and positive psychology, there was kind of a synergy. We had gotten to a point with positive psychology where I thought it was probably at its finest and strongest point from a research angle. We knew more about neuroplasticity and to be able to rewire your brain and those kind of things. And so I thought when the perfect time came around, I thought that it could be useful. So I took the nursing leadership in our nursing leadership meeting, and I said to him, I can't promise you that this will make a difference, but if we go through these 7 principles, and we did a principle a month, we really went into them, and I said, it gives you some more tools to be a little happier. And mind you, we're getting ready to go into the worst part of the pandemic for us. I said, then I think it's worthwhile. And then the influence that it might have on our organization, if you look at the research, I thought it would be beneficial. You don't predict. It was, at the time, it was a pretty ugly situation. But they stuck with it. We went through the 7 principles. We learned some skills and some tools. And slowly over time, you could start to sense, especially in direct communications, interdepartmental with each other, it was starting to get better. You could start to see some of the light. And then I had a conversation with Mr. Williams, and I said, first I asked him about going through the Happiness Advantage. He said, yeah, absolutely. Let's try it. We got to try something. And then we pivoted from that to a book club. And that was Darren Tully's book, Live Your Possible. And so again, it just kept that conversation going that we need to focus on us. Let's us get healthy. Because if you look at all the research about me having a happier, more engaged brain, I'm a better version of me. And if I'm a better version of me, what I do should have positive impact on that. So So that's really the gestalt behind it. And so that's kind of the direction we took it in. I have to tell you, I'm an optimist, and I felt like it would help. I'm also hard-headed a bit, so I was persistent about it. But at the end of the day, I had no idea that it would have the enormous impact that it's had, and it only validates for me when we're looking at what we need to do differently in healthcare. This is where we need to look, and it's the last place we want to look because no people don't like vulnerability, and you have to acknowledge vulnerability to go down this path.
What were
So,
the 7 principles, and what are the key initiatives that you put in place?
well, so the 7 principles. First, it's the brain on happiness. Then it's about changing mindset, um, uh, dealing with conflict, being stuck, socialization. So as we went through each one of those principles, we applied it not only to our work environment, but many times it kind of ran into the personal environment as well. And so that was the benefit of that application of those principles. And it really, I think, at the thought is that I have an illusion of control over what life is and how life happens to me. And but I do have complete control of how I respond to it.
Hmm.
And so that's really the focus. It's about creating a mindset of how can I better respond to the ebbs and flows of life, um, without either being a victim or creating victims. And so that's kind of how it went.
But you said something, and I'll point out nothing about what we've done has been um, systematized or required, or it's all voluntary. The book clubs that Dakota mentioned, we just mentioned that. Look, we found this new book. You want to learn more about positive psychology, how to make things better. We're having this book club, so we got 15 or 20 people that just volunteered to participate in that, and there was kind of a groundswell, and then a second one started. So it's grown organically, and there hasn't. I mean, there's some formal coursework that is offered about the happiness advantage, but again, it's opened up. It's open for the entire workforce. That, gee, if you got 9 weeks and an hour a week, sign up for this and learn about it and improve your life and figure out what we're doing here. So we model it. The leaders in the organization that buy into this model it with their employees and the people that they interact with. We've got everybody has a slogan, and healthcare is an acronym heavy, but ours focuses on the word thrive. And each letter of the word thrive fits into the culture that we're trying to create. The T is trust, because you've got to have trust to make this relationship work. The H is honest and open communication. R is respect. So the trust and respect that Dakota was already talking about. It's respect that you give. It's not respect that a position supposedly commands, but it's respect that you earn and respect that you give. I is inclusiveness and innovation. This is different. We're innovating a way to change the culture of an organization, and we've got to be inclusive. We're a very diverse population, and we've got to be inclusive and understand where people are and where they are in life. The V, vulnerability. To be able to share stories about yourself and how things impact you just builds that level of trust and that respect when you share that with people. And then the E is expectations and excellence. Dakota's mentioned it to me on several occasions. So many things around quality and healthcare talk about being perfect. Well, you can't be perfect. You just can't. There's only one thing that was perfect, and but you can be excellent, and excellence is a journey, and you can be better tomorrow than you were today. So that's that journey towards excellence, and you can always do better. So that's why we have excellence in that piece. But it's all about creating an environment where people can thrive and find joy in work. Because some smart guy said a long time ago, if you're happy with what you do, you'll never work a day in your life. So, why not have joy helping other people? And that's what healthcare is all about. And one big thing that we changed, a lot of initiatives in hospitals, talk about focusing on the patient, make the patient number one, focus on the customer. And we've made a conscious decision that we're going to make our employees number one. We're going to focus on them first so that they have the tools and there's nothing impeding them from taking care of the patients. And we've seen a dramatic turnaround in some of the metrics. It's validating what we're doing. We recently completed the ARC survey on patient safety culture, and we more than doubled our net promoter score within that measurement, and we had a 85+% participation rate, engagement rate from the employees, where the national average is 46%. We've also just completed an employee engagement survey with Press Ganey, and we had 81% participation from our employees in that survey, significantly higher than what they see in healthcare organizations. And our net engagement score increased 25 basis points from the last time we did the survey. The folks from Press Ganey were, when they were sharing the executive summary, they just said, we don't understand. I mean, we don't see these types of results. It's not something that we're familiar with talking to people about. We're normally got a whole list of things that you can start focusing on and working on to improve. You don't have anything in those lower quadrants. Everything's in the upper quadrants. They tier your leaders as tier 1, tier 2, tier 3, as being able to implement change and do things. And 87% of our team are tier 1 leaders, so they're able to go without any assistance, implement change to improve the organization. And 13% were tier 2, and they just need minimal support to make those changes, and no tier 3. So the lowest percentile ranking that we saw on any of the results was the 77th percentile, which is pretty good. But it ranged up to the 98th percentile on many of the scores, and we saw a minimum of 20 basis point improvement in the 6 areas that drive that employee engagement score. So it's kind of validating what we've been working on over the last couple of years, and looking forward to continuing it. So.
Yeah, I think I just want to echo Mr. Williams' thought about the paradigm shift that's occurred here, because I know, being a clinician, a lot of people right away, we don't talk a lot about the patient, and so our thought behind this was that, again, if the research is sound, if this works, then the results will handle themselves. Being mindful that very early in, we didn't have a lot to bank that on. But when the AHRQ survey came back, the patient safety survey, and in the benchmark category, 6 of our elements were above national benchmarks. Two of them are right at benchmark. If you compared us to the prior survey, 9 of the 10 elements were above the previous survey, and 6 of those were statistically significant above. And they, Mr. Williams had mentioned the Net Promoter Score. When we were talking to them, they go, "We've not seen this before. What are you doing there?" And so that was really for us validating that this was something very different. So the paradigm shift is focused on the creating an environment where our employees, our staff members, our team members can find joy at what they do, because that's why we get into this business. Everybody gets in healthcare as it's a very personal connection, and that's what's happened, and the end result has been very positive. It echoes and validates what we've seen in the research.
Yeah, in terms of, I mean, it all makes sense, which is if you're happy, you're going to do better work. It's the oxygen mask principle, right? Take care of yourself first, and it will come for everyone else around you. So one of the questions I have is how has this impacted? And we talked about engagement scores and net promoter scores and stuff. How have you seen it impact culture or retention day to day, and some of the issues that hospitals across the country
Sure,
are
absolutely.
facing?
I'm glad to share some. So we had a fall rate that was probably above the national average, which according to HealthStream is about 3.44 inpatient falls per 1,000 patient days for med surg. We're down to less than one. That's about one patient fall per 1,000 patient days. We're July, almost August. We've had 2 falls this year inpatient wise.
In 7 months.
In 7 months. We're well on our way to being a zero fall organization. And it's the capitalizing on the energy around creating a positive environment and focusing on doing what's right. And that's actually energized that. If you look at how falls are usually addressed, it's, oh, we got to get a subcommittee together. We're not doing the right thing. We have to move people around. People need to be more engaged. They're not watching the patients enough. It's about accountability. And really that's not how we handled it at all. We certainly spoke to the issues of falls, but we did in a very different way. We have a patient safety officer that created a falls committee that looks for opportunity to see falls through a whole different lens, where it's a lens of accountability in most organizations. It's a lens of opportunity here. And so that's, again, I fully expect that at some point in time, we'll be saying that we've had 0 falls for a full year. And again, our case mix index, which is our true objective indicator on our patient acuity, hasn't changed. As a matter of fact, it had been higher for a long time than it had been historically. And so our patients were more complex. They were harder, but they were falling less. And they weren't falling less because, there was any magic. It was just that people were in a better place to protect and do the right thing. And that's what it's about. That's one I could share, our med scanning, all that. It's all better than it had been, and in most cases significantly better.
So during the 2021 reporting period, we had 40% turnover in the nursing service area. 40. The end of the most recent reporting period is 19%. So something changed.
Is now thinking about it, you're set up in a very potentially unique situation where it's a tight team, it's a close team, it's a smaller team than potentially some hospitals around the country that are facing similar issues with retention, with environmental, I guess, lack of happiness, if that's a way to say it, a lack of joy in the workplace, just because it's become, one, more commoditized, and two, just more stressful, right, to be a healthcare worker in this country these days. Are these lessons, you think, that could be applied to hospitals that are different than yours? Not a critical access hospital, not a small hospital, but maybe even a large hospital, 500 beds, 700 beds, 300 beds. How much of this is replicable? Even if it's not systematized, how much of the process and the learnings behind it do you think could be used? Because as you probably know, talking to your peers in healthcare administration, there are many hospitals facing exactly the same issue you faced and that you improved in terms of staff retention, especially nursing retention, in terms of patient care issues and outcomes and clinical improvements, all of that, right? And those are huge problems that impact not just the quality of care provided, but the financial situation for all of these hospitals. So would love to see if you guys think this
I
is
think
something that could be
I think what gives me the most hope and the most passion surrounding this is that this is not an economy of scale thing. This is just about treating people in a manner in which they can be the best that they can be. And we talk about it all the time. I've been at Studer hospitals. I've been at university hospitals. We talk about it all the time. It's the application of it that doesn't work. So why it's worked here is because this gentleman sitting to my left, the CEO of the hospital, said, this is where we got to go. I see the benefit in this. And then he started to believe at a level that you have to believe in to interpret it into the environment. So from the top down to the bottom, inside and out. And that doesn't mean that we didn't get resistance. I had people quit because they didn't want to be happy. Literally said that. Literally
Wait,
said that. I don't. So I think at the end of the day, is it transferable? Absolutely. Are you willing to be vulnerable? Are you willing to look in the mirror first? Because that's what it takes. It takes an honest conversation with yourself. What are you willing to do to create that environment? You know, there's other industries that have done this. Menlo is actually we share their mission statement, which is they wanted their employees to thrive. They wanted to create joy at work. And so that's another industry where it was comparable, and it works very well for them and has worked long-standing for them. And so absolutely, I believe it's transferable. More than that, I think we're obligated. You look at burnout in this industry, people that have walked away from this, that got into it with a passion. The things that we're doing here help avoid those that kind of symptom buildup over time. And that's the importance of this. You know, Mr. Williams had mentioned that we don't shoot for perfection. Do you know what's caused by people who aim for perfection, even though we know A, it's an illusion, and B, if you believe you can do it, it's delusional, is that, you know, you're generally more unhappy, chronic headaches, hypertension, all those kind of things come into play there. And you put that into an environment that's already, you know, being challenged by things like the pandemic and politics in the pandemic and sicker patients and more staff turnover. So what we're doing here, absolutely very transferable. My question to anybody who's running those larger organizations, what do you want to do about it? What are you willing to do about it?
Yeah, I mean, I'm sure that, you know, we chose to make it organic and to spread it organically and and very purposely have not put it in a box, because we that innovation piece that we were talking about, that's in the word thrive. I mean, every manager that is working on the positive psychology in their department is doing it differently. There's no wrong way. And if they need help, we'll help them and make suggestions and offer suggestions. There's a world of books about positive psychology and how you can impact yourself and make yourself happy. So, you know, there's a world of ways that you can do it. So, you know, is it scalable? Is what we've done scalable? Yeah, you've got to have somebody that believes in it and is invested in it and wants to make it happen. And there's got to be support from the very highest level to shut down or deflect the naysayers that surround it. Like any other initiative in an organization, you know, when we first started doing computerized physician order entry, I mean, it was a big division, you know, in medical staffs about, well, I'm not going to do that. You can't take away my pen. Well, yeah, we're going to, though. So how do you make that happen? Somebody at the very top said, we've got to do it. And you made it happen. So it's no different.
Well, thank you so much for sharing your journey and how you guys were able to make such a dramatic impact in your community and at your hospital by something seemingly as simple as bringing joy to the everyday, right? And bringing happiness to the everyday. Just to close off with, what are you excited about for this going forward? Whether it's a continuation of this or something new that you're working on now, since you're now, addicted to the drug of innovation, if you will.
Well, I think for me, that's the excitement of it. I can't predict that. Where it'll come from, whose ideal it'll be. I shared with you what our patient safety officers tilt is on patient safety. Those things are very exciting to me. I had a nurse or nurse leader who interviewed a potential new nurse yesterday, and they were telling that new nurse about Thrive, and she goes, I've never heard anything like that in any other organization I've went to. I want to go to those classes. And that director came to me, and she was so excited at the response of this potential candidate, that she was just you could see the pride in her. And so it's those things that, we're doing Thrive 2.0, Mr. Williams added excellence. So those are the things that excite me. I told the group yesterday, I said, I'd like to be retired boondocking in the desert and hear about Thrive 14.0.
No, I mean, we're starting to reach out now, and just like this opportunity with you, there's some other opportunities that are coming forward that we're going to try to capitalize on and talk about what we've been doing. And if it gets, one other organization interested in doing it and we can help them, then that's where we are right now. I think, we want to continue improving and seeking excellence within our own organization, but, you can help other people, so that's what we want to try to do.
That's fantastic. And I'm sure I'm going to get people pinging me on this, so I will be sending them your way. Thank you both so much for the time today, and I hope you have a lovely rest of your Friday and a lovely weekend.
All right. Thanks,
Thank
Nina.
you.
We appreciate it.